With it, the threat of what public health experts have termed a triple-demic. According to Ottawa Public Health, there having been rising trends in COVID-19, flu, and RSV. Where COVID is concerned, there were 207 new cases, 3 related deaths reported in Ottawa in the past week. With more on this, we reach Raywat Deonandan, epidemiologist and associate professor at the University of Ottawa. Hello again.
Hello, how are you?
Doing okay. Why are we seeing this rise now?
Well, this is what we come to expect now this time of year, pretty much every year. We saw this last year as well. People are going indoors more, and people have taken their foot off the brake pedal when it comes to COVID mitigation strategies. So transmission is increasing, and uptake of the new booster vaccine is very, very poor. So this was all expected.
Let's talk about that booster shot uptake first, because it was a poll that was conducted, I guess, for Global News, but they revealed that 40% of Canadians don't plan to get a booster shot this fall. How much of the increase do you think has to do with that low vaccination uptake?
It's impossible to quantify it, but 40% is higher than I thought it would be, frankly, in terms of people wanting to get the vaccine. I was looking at Public Health Ontario's most recent surveillance data suggesting that only 900,000 people in the province have got it so far, so that's 6%. In Ottawa, it's a little more, it's like 7%. It's really a shame. It's a very good booster. It seems to produce good quality neutralizing antibodies, the laboratory studies suggest, which means not only will it help us stay out of the hospital and out of the morgue, it has a pretty good chance of preventing symptoms and transmission altogether. And for kids under 5, that group actually has the highest chance of hospitalization in the pediatric population if they get COVID, and yet only about 5,000 kids in this province have received the booster so far. So to answer your question, I don't know how much is contributing, but it's not helping.
We're seeing the rise of new subvariants, the HV1, XBB. What do we know about them?
So HV1 is about a third of the American cases, about 24-25% of Ontario cases so far, and it's increasing. These are descendants of XBB, and XBB is a descendant of BA, and BA is a descendant of Omicron. They're all part of the same glorious family. The good news is that the new booster is tweaked towards a version of XBB, so it should be at least a little bit, probably a lot, effective against HV1 and its siblings. It doesn't seem to be creating any more serious symptoms, but all of these new variants, all of these descendants of Omicron, all have one thing in common. They're increasingly able to transmit. They seem to hug the cell more snugly and therefore have a higher chance of infecting us and causing disease.
This is purely anecdotally. It seems as though these most recent variants seem to go through children fairly quickly and hang on longer in older people. Is that accurate?
This is the first I'm hearing of that. It doesn't mean it's not true, just I haven't heard of that before. Any number of things is possible. The problem is there are a lot of confounding factors, like how recent was a vaccination, how recent was a prior infection, what were you infected with? So the variability in individual immunity status is so great, it's impossible to make predictions about any of this. Also, there are a lot of viruses floating about. There's not just the new variants, but the old variants are also present to some extent. We have RSV, we have flu, we have the common cold. Everything is confusing the data, especially anecdotal data.
How concerned then should we be about the onset of a new wave of COVID cases? I mentioned 207 new cases in Ottawa in the past week.
Well, currently the wastewater signal in Ottawa suggests that we're at infection levels comparable to what we saw in January of this year, which is pretty high. Hospitalization numbers are not, they're not overwhelming, but they're etching upwards a bit. We might have peaked. Some modeling suggests that we're at the peak right now. It's unclear. But definitely, we do not want to increase transmission, especially as the RSV numbers are just starting to pick up, and especially as we're at the early stages of the flu season. So the more we can prevent respiratory illness from entering our hospital system and touching our most vulnerable population, then we should do that, because we're entering those weeks where things are the diciest, most vulnerable.
What would you recommend people do to protect themselves then?
Number 1, get the new booster vaccine if you haven't done so already. Number 2, get the flu vaccine if you haven't done so already. I don't know what the uptake is in Ontario for the flu vaccine, but in the US, It looks like it's less than 50% of the population, which is troubling. Number 3, be aware that these diseases exist. They haven't gone away. And I think there's a narrative out there that the emergency is gone, the crisis is gone. To a large extent it has, but to a large extent it hasn't. Number 3, or 4 or 5, whatever number we're on, consider strategic masking. What do I mean by strategic? If you're not willing to mask all the time, then mask when you're in crowded indoor settings with people whose status you're not aware of. That's going to help enormously. In particular, healthcare settings, which should be a no-brainer, but sometimes it isn't.
And kids in school?
Yeah, so kids in school, like I have a kid in daycare, and he's always got a runny nose, and his friends are always have runny noses. The daycare workers are masked for the most part, so they have to protect themselves and their families. If you can keep a sick child at home, which is hard to do, I know, then you should consider doing so. And I'm hoping that parents get their kids vaccinated with the new booster. Yeah, it's the probability of a child ending up in the hospital is less so than an adult ending up in the hospital, but we want to prevent infection from moving through the child population into the adult population. So consider doing so. And for those policymakers out there, consider improving ventilation, putting better filters in classrooms, opening windows, using our spaces more effectively. This is the large unaddressed option in society that we have not yet tapped.
And just before I let you go, I mean, we're intermingling here in our conversation, COVID and the flu and RSV, but what is the outlook for this year's flu season?
Unclear. Again, the positivity rates is pretty small right now for the flu. It's less than 1% in Ontario. Based on what we saw in Australia, maybe not as great as in previous years. So the flu is not the great challenge right now. It's COVID.
Raywat, thank you, as always, for this.
My pleasure. Thank you.
That was great. Thank you so much.
Good times.
We'll talk. Yeah. Fantastic times. Yes. Wonderful. All right. We'll talk to you later. Thanks.